to the long-term care program, there are a lot of numbers moving around, and so I think it's important to emphasize what our doses, our first and second doses. Likewise, facilities are fully vaccinated. So I want to make sure I'm sticking as precisely as possible to what the CDC studies sometime in the residents that were vaccinated was 80%. So that gives you, I think, they will likely continue to use in the near term. I think your question about dealing with separate registration systems, people may want to try to understand more about how they can find a place where they can get vaccinated, and I think particularly as there's more supply, that's going to be important. And I have nothing to announce today other than that we are looking very closely at that question and how we might be able to help people. Should we go to the next question?
Hi, everyone. Thank you. First question is, can you give us your assessment of some of the states that have begun to relax their protocols? For example, Iowa among those who has reversed some of the indoor requirements in terms of masking and public social distancing. And also, given that a number of schools all across the country are discussing how they are going to reopen, there is an urgency to that matter. I know that you said that the CDC's guidelines for school reopenings would be coming soon. When can people expect to see that? And have you gotten to a place where you can give us any indication about whether you think teachers should be vaccinated before schools reopen?
Great. Well, I think both of those are probably going ahead for you, Dr. Walensky, but let's do them. First one is your comment on states or local jurisdictions that may be relaxing some of the public health standards that the CDC has been recommending.
So maybe I'll just start and say, given that we're still at over 100,000 cases a day, I would discourage any such activity. And I would say that we are still in the first 100 days where we wanted certainly everybody masked for the first 100 days. I think we have yet to control this pandemic. We still have this emerging threat of variants, and I would just simply discourage any of those activities. We really need to keep all of the mitigation measures at play here if we're really going to get control of this pandemic. And in that regard, as we move towards and think about schools, what we know mostly about schools in terms of the data are that most infections come into the schools through the community. The data from schools suggests that there's very little transmission that is happening within the schools, especially when there's masking and distancing occurring. And that when there are transmissions in the schools, it is because they've been brought in from the community and because there are breaches in masking and distancing. So if we want to get our schools open and our schools open safely and well, the best way to do that is to decrease the community spread. So I would say we need to keep up our social distancing and our masking and all of our other mitigation measures. Our CDC guidance on school reopening will be coming in the days ahead. And I look forward to thinking through those with everybody.
Great, thank you. Do we have a next question?
Last question will go to Isaac Stanley Becker at Washington Post.
Thanks for taking my question. It follows up on Kristen's first question. So in light of the fact that this is the recommendation of the CDC, can you say a little bit more about what the administration is doing to communicate this guidance and these instructions to governors and other officials out in the country, discouraging them from taking some of these steps? Or is this largely a state and local matter where the administration's power is limited?
So I just wanted to confirm, not that the question was asked that long ago, but your question, you're talking about conversations with governors about steps that those that are taking steps to relax mitigation standards. Is that your question?
That's right. Just if you could say a little bit more about what the administration is doing to provide counsel and instructions on issues like mask mandates, dining restrictions, to, especially in light of the spread of these variants?
Well, all across government, we talk to the states incredibly frequently, so maybe we'll go around and see Dr. Walensky if there's anything you want to add to your previous answer.
I will just say, I think our stand on this is pretty well established. I attend a weekly governor's call at least, and I know that, and I've been in touch one-on-one with numerous governors already. So I'm doing my best, and I would happy to be doing more to encourage the states to decrease their community spread so that we can decrease the threat of these variants, decrease our hospitalizations, and get this pandemic under control.
And the only thing I'll add to that is that, we understand the pressure the governors are under. We are taking a collaborative approach as much as possible, sharing with them the data, helping them understand, as we've covered on this call, why we're in such a critical period to combating the virus, and hope to continue to work to persuade and partner with states and localities to continue to follow sensible public health measures until such time as we're in a situation where the case rates are down lower. We think that's wise. We think that the voice of the CDC is preeminent here. They look at all of the data. They're clear in communicating with the public, and we'll continue to have those conversations with the states. But I won't go into any of the specific one-on-one conversations that we have with states, because I think that might be counterproductive. I want to thank you for attending our briefing. I think we hit the half-hour mark pretty precisely. We look forward to a productive week collectively, and to talking with you all again on Wednesday.